Well, hello everyone, and thank you for attending our COVID-19 Town Hall Unanswered Questions live stream. My name is Holly Foxworth. I'm a registered nurse with Axiom Medical. And as most of you know, Axiom has been hosting a weekly COVID-19 webcast series on a variety of workplace-specific topics. In Thursday's Risk Mitigation, the changing landscape of employer liability and responsibility, you guys asked some really great questions that we weren't able to answer in the broadcast, so we wanted to ensure that you had the information via live stream. But before we get to those, let's go ahead and say hello to our COVID-19 panel, who've been helping employees navigate this pandemic from every angle. Welcome to the show, Chuck Cable, Axiom's Chief Legal and HR Officer, Dr. Scott Cherry, Chief Medical Officer, and also Malcolm O'Neill, Vice President of Human Resources and Administration for BJ Services. Given that you each have very different roles, why don't we start with brief introductions, and Chuck, we'll start with you. We'll let you go first. Chuck, can you hear us okay? Actually, I'll tell you what, let's go ahead and go to Dr. Cherry then. You may be having some problems.
Good afternoon, everyone. My name is Scott Cherry. I'm a board-certified occupational environmental medicine physician. I'm also trained in preventive medicine and public health. And I've been serving or supporting military, corporate, and industrial operations for the past 15 years. And it's been my pleasure working with our clients during this pandemic.
Great. And Malcolm?
Good afternoon. Malcolm O'Neill, Vice President of Human Resources with BJ Services. We're an oil field service company headquartered here in Houston with employees in Canada and across all the major oil field basins in the U.S. And we're we have an essential workers exception, so we've been actively maintaining our workforce during the pandemic to date, and also in the process of reactivating and phasing back in our corporate headquarters here in the Houston area.
Great. Do we have Chuck now? Chuck, we'll circle back to you for a brief introduction.
Sure. Chuck Cable, Chief Legal Officer for Axiom. I also take care of the HR team here at Axiom, and happy to be here today. I've been an attorney for about 20 years, and so happy to answer questions that came in over the webinar.
Great. Well, just to follow up on the content that we discussed last week regarding the OSHA enforcement and memo, and then also the Every Worker Protection Act, and really the importance of getting employee input and buy-in. I noticed that over the weekend that the work hazard complaints at OSHA really appear to skyrocket. It looks like that OSHA in Oregon, which typically gets somewhere around 2,000 complaints in a year, has now had close to, well, I guess it's over 3,500 complaints in the span of just 1 month related specifically to COVID-19 and issues like social distancing and protection in the workplace. So do you all feel like this is going to be a trend that other states are going to experience or maybe should anticipate?
I mean, I'll go first. I think without question, this is to be anticipated. You know, there's a couple of things at play here. You've got, you know, enforcement guidance that came out from OSHA, you know, in early April, indicating that COVID-19 was going to be recordable. On top of that, you have states taking action already to reduce the burden of proof in workers' compensation claims. And for those states that have state-based OSHA organizations, they're taking the same tact. So I think employees are either out of work, about to be out of work, you know, or not making enough money to support their families. There are all kinds of issues that are being created, and folks are looking to place blame. And so I think from an employee base, folks are going to look to hold their employers accountable if they feel like their employer didn't do enough, whether they're essential or not, right? And I think that's a play here. I think the plaintiff's bar is going to continue to become more active, soliciting cases, right? Looking for opportunities to create litigation and other issues for employers across the country.
Great. Does anybody else have anything they want to add to that, Dr. Cherry?
You know, I think that, you know, there's so much confusion about COVID-19 and how it affects people's health, and then obviously into the workplace. If there's not a clear policy by companies, employees may not, I guess what I'm getting at is communication is absolutely key here, as well as having a firm policy on your COVID-19 contingency plans, exposure control plan, because if those aren't in place and risk communication and risk and hazard communication is not effectively done in the workplace, the media and the uncertainty will dominate the employee, and then they will utilize that complaint hotline most likely because they're concerned about their own health and they're concerned about their ability to make a living. How about Malcolm?
Yeah, I think you guys really have a nice framework there in terms of, I think our position is that the world that we live in 5 years from now will very much in large part be determined by the first movers. And I think when we think about our role as a company in terms of, you know, the framework of the law of do no harm, I mean, it's our opportunity to take that lever and to move it. It does mean that we may have to experiment a little bit. We won't always be right. We'll have to continue to pivot and to change, but it's our ability as companies to really take this as an opportunity to lead and lead our organizations. And I think in many ways too, that proactiveness is there's the goodwill that buys from the employee, but it's also much to what we're talking about. It is a great mitigation strategy in terms of continuing to de-risk this from a company standpoint.
Sure, absolutely. Well, they did mention that the agency was announcing they're going to start doing some spot checks there to verify that employees are really adhering to some of those directives there. So, you know, as we discussed in the previous webinars, implementing these workplace safety strategies, risk mitigation strategies, that really is going to be key moving forward. Before we get into the questions, I did want to mention I had a number of you reach out and ask, how can I have my COVID-19 questions answered by the experts? That process really is easy. If you'll email your questions to coronavirus@axiom.com, axiomllc.com, I can promise you that we will tackle them. So whether that's health, safety, HR, whatever it may be, what to expect in the future, let us know what's on your mind and we'll make sure to get those addressed for you. Well, let's go ahead and jump into some of the questions. The first one relates to masks, and so Dr. Cherry, I'm going to come to you first. Jerry says, oil and gas employees have been mandated to wear masks and facial coverings while working on pads. So by wearing the mask, the employee is rebreathing the CO and CO2, as well as bacteria that is forming and being rebreathed. So where is the liability, and how do you address that in the policy?
Yeah, that's a great question, a very technical question about respiratory physiology there with carbon monoxide and carbon dioxide. And so just to take this one piece at a time, I don't believe there will be any significant amounts of carbon monoxide retention or rebreathe because of a facial covering. Just the body has very low levels of carbon monoxide in general. Smokers will sometimes have a 5 to 10 times higher carbon monoxide level, but still, that's still in that event, that's still quite a low level. Obviously, CO2 is a main component when we expire, and I think we've all seen kind of hyperventilation into a brown bag that would help kind of increase your CO2 level, things like that. You know, the facial coverings are not tight fitting, and so there's really not a significant portion of your expired gases to be rebreathed. And so I would not have a large concern for most people about having CO2 retention or carbon monoxide retention. Specifically about bacteria, you know, I don't think bacteria also will be a major component of this, and I'm not sure if that question is conflating the COVID-19 as a bacteria or a virus, but even for COVID-19, I think what's crucial would be to have a policy that addresses hygiene of your mask or utilization of your mask. So if it's a reusable mask, that it be washed daily and you know, after shift, things like that. But in my opinion, I don't believe that there will be significant, again, carbon monoxide or carbon dioxide retention as well as exposure to the person's own bacteria. There may be some studies that will eventually come out to address this, but I know that there's been a few studies in the past looking at surgical masks for surgeons or for the surgical team, and there is some slight variations in some of their respiratory markers, but nothing of a significant degree.
Okay. And then Chuck and Malcolm will ask several questions to you guys. We had several that came in related to managing and tracking the data. So Donald asked, how would you manage and track the data points for a trucking fleet that is scattered over 5 states and 30% of the locations where there's no one to check the drivers prior to the start of their workday?
Yeah, interesting question. And I think it plays into kind of one of the key risks that we've talked about for a number of weeks now, right? And it's the fact that, as HR organizations are kind of changing the way they're tracking employee data, what we're finding is there are just a ton of data points, right? And so the question becomes, how do you begin to manage and track those? I think the issue is consistent whether you're a multi kind of state trucking company versus the work that Malcolm's company is doing, BJ Services. I mean, these issues exist for many, many different organizations, and I think that from a practical perspective, you want to be able to have a process by which the drivers are checking in on a daily basis and reporting based on a key set of questions that your organization would essentially develop either internally or potentially go get assistance with externally with a company like Axiom. I think that early movers in this space have developed technology tools via app, potential call-in numbers, and other kinds of tools to allow for folks to, make a statement on a daily basis as to where they may be from a symptom standpoint. I think technology is still very much in development here. You've got some interesting standalone technologies, right? You've got, smartwatches, you've got smart thermometers, and these other tools. I think it's going to take some time for those things to be integrated into this process. But I can tell you that from my perspective, where Axiom sits, it's a much easier question because, we have a tool called Check Into Work that is designed to provide that daily check-in no matter where your folks are. And then, of course, report that data on a regular basis to our clients. So it's easy for me to kind of speak to a solution that we offer, but I think it provides context for you to think through, how your trucking organization can manage a dispersed workforce, right? I mean, and that's a challenge that many organizations are going to face in this new reality. As we seek to manage what's expected of us and keeping our workforces safe.
Great. Malcolm, did you have anything that you wanted to add to that?
Yeah, I would just build off what Chuck shared about, in terms of, a distributed workforce there and the data points. And I think what's really been key for us is to find ways to take our crisis response and integrate that into our already existing plans and programs. So we actually have a Department of Labor or a CDL population within our group. And so what we've been able to do is we already had a mental model around journey management. And much like Chuck was speaking to, we've automated that. And, early days, I mean, our checklist, our self-assessment, our certificate to work was just the 8 questionnaire type piece we had. And it was each employee typing 1 through 8 with yes, no into their supervisor. And then, we've automated that through an app. So we have been able to now take that. And now we're starting to take this data, and this data becomes more from a reporting standpoint into the beginnings of a management information system. And that we can ultimately see, where do we see the failure modes? How do we move from the individual into population health? And I think for us, it's really about just good data flow, good process, good discipline behind it. I think that's one thing too, that it has the friction that might have been there, with the pandemic here has allowed us to accelerate the adoption to these tools. I mean, no different than we've seen the workforce migrate and the adoption hurdle low on teleworking and the tools to collaborate. We've seen the adoption rate of our tools to be very easy and to be very quick within the population. So I think much like we said, it's about, just good process flow, and then, obviously finding ways to automate it to continue to harness the data so that it ultimately lends itself to more of a management information system long term.
Yeah. Sure. Yeah, totally. And one thing just to add to that, I think as well, for those of you that heard me before, policy matters, right? And it's also ensuring that you're not just kind of going out and seeking data for data's sake, right? It's everything needs to be managed through kind of a master policy approach where you're simply indicating, that to keep our folks safe, to make sure that they've got the certification necessary for them to not just kind of take the trucks where they need to go, but deal with the distribution center folks and whatever standards they have. You have to have a policy in place that says our drivers will follow this process every day, right? And I think once you've got an infrastructure to kind of speak to why you're doing it, and the process, to Malcolm's point, and the process discipline to back it up, I think tracking those data points will essentially equate to management, right? Because you'll have a policy that says these are the things we look at, here's why we look at them, here's what we share with our broader kind of partners in terms of their concerns about the safety of our drivers. It'll kind of evolve over time for sure. And to be fair to everybody, right? I mean, it is moving so quickly and so many changes are happening. This is all evolving over time. So I think first and foremost, figure out what works today, and then continually kind of look back. And I know it's tough, we don't have a lot of time, right? But continue to look back and evaluate how it's working and how you can improve it, where you can kind of ease the burden on your admin folks, because those are the ones that are going to feel it most acutely, as we start to kind of manage this new data process for our employees.
Great. And then Brian was asking if you could maybe expand upon that a little bit further, asking what specific data points should be managed and tracked for risk mitigation.
Yeah, and I think, I'm happy to get into a little bit of detail, and I can defer to Dr. Cherry for his perspective. But I think, our perspective is infectious disease is more broad than COVID-19. So there's an opportunity to kind of take this data point process to a broader place where you're ensuring safety, not just for COVID-19, but for perhaps other infectious diseases that do exist and may exist. I think most immediately to deal with the concerns today, temperature, and then there's kind of the top 7 symptoms that CDC puts out for folks that may have COVID-19. It's running a process. Do you have any of these symptoms? When did they start? Have you, been exposed to anybody that has it? Have you been exposed to anybody that you think has it? It hasn't been confirmed yet. It's these kinds of questions and data points that need to be kind of considered and stored for each individual so you can take appropriate action. I think there's another question about sick days we're going to talk about here shortly too, and that kind of plays into it from a holistic policy perspective.
Sure.
Scott, you need to add to that. I mean, you know the stuff more than I do, but that's kind of my big picture.
No, I agree, Chuck. That's a great advice you're given there. And what I think needs to be embraced is the general principle that will help guide which metrics that will apply to your business. I think what really needs to be solidified from a company policy is your tolerance for illness in the workplace. And I think it could be considered common sense that we don't want, business leaders don't want ill or sick employees in the workplace. However, there's a continuum of enforcement or culture of allowing sick and ill employees in the workplace. And so because of COVID-19 and its major implications to business operations, to the economy, how OSHA is starting to look at personal illness as potentially work-related or to other coworkers, I think this is the time now for companies to embrace a policy and procedures that, reinforce the culture of zero tolerance of illness in the workplace. Even in this time now, when I talk to friends, family, just different folks in my life, it's amazing the disparity of their perception of what is sick in the workplace. And so, if you have a sore throat, you should not be going into the workplace. If you have, any kind of these symptoms that are not normal for you, and I think having, either a technology or some type of process that documents compliance to this is going to be absolutely crucial for, one, risk communication, culture change, but also for future use if you're trying to speak to your policies in defense of litigation.
Okay. And Chuck, you and Malcolm, we want both of your HR perspectives here, but Heather is wanting to know what businesses are doing to address sick leave for COVID-19 impacted employees. wanting to know, are they extending sick leave benefits or maybe short-term disability?
Yeah, another good question that's come up a ton, and I think that the first, probably most important thing to think about in terms of sick leave is, whether your business is covered by the federal law, that essentially requires 14 days of sick leave under certain circumstances, right? So that's kind of the most important thing to look at. And so I would advise you to talk to your counsel, your attorneys, to kind of determine whether you meet the definition required in that legislation that is law now, right? And so there is very much the sick leave component that matters. Short-term disability, I mean, that kind of is an established process. I don't think there's anything, to my knowledge, that's changed the protocol there. Other than you got to make sure your short-term disability carrier is on board with kind of running these COVID-19 cases, which I think most of them are at this point, based on my understanding. But that's the biggest thing. If you're a larger organization that's not covered, I think you have to have 500 or fewer employees to be covered by the legislation. If you're larger than that, I think that it's on you to determine what makes the most sense for your workforce. I feel like part of the reason 500 was the number is that 500 and larger, most of these large organizations either are beginning to have more defined sick leave policies or have policies in place. So I think it was more of a guide for smaller organizations that hadn't gotten far enough along to make that decision, maybe. But I very much feel like that's kind of the first thing to do is, figure out if your business is covered by the sick leave policy and then execute on it. And I think, more broadly, as we think about kind of the new normal, the kind of daily health attestation approach that, we've been an advocate of for quite some time now, there's other benefits here in terms of sick time generally. I feel like, up until the pandemic, I think we were spending in excess of 170 billion with the B dollars per year on lost time from work due to being sick. I don't think a lot of employers put a ton of focus on that lost time unless it was kind of leave mandated by, state or federal law, right? And so having people sick in the workplace up until now really wasn't a kind of a big deal. OSHA didn't kind of hit you for it typically unless it was one of these epidemic or pandemic type illnesses. But now I think businesses are understanding that it's not just about regulation, right? It's about whether you've got enough people to get the job done to make sure you can continue to be a going concern. And so I very much feel, that the new normal in this circumstance is to take a more defined approach to managing sick time. And the daily health attestation, if you do it right, you're gathering information on individuals that you can then drill down to locations and start to see if a location is experiencing similar symptoms. And you can begin to kind of put together where various locations may have an outbreak of a disease. Could be the flu, could be some other bacterial infection. There's opportunity there to mitigate the losses that you would have incurred otherwise, as evidenced by kind of the data that had been tracked historically, over $100 billion, almost $200 billion a year across the country for all business, right?
Malcolm, did you have anything that you wanted to add to that?
Yeah, I think just from being out there on the other side of it, as a business that has been tracking this, one of the things that we do is we actually have a daily report where, ours just folds right into our leave absence administration directly into short-term disability if the right stage gates are met. And then in terms of, as Chuck was alluding to, the size and the cost of this, so we actually have we get a daily report from our management system that basically shows us our days away related to what we've dubbed our contagious respiratory illness report, so that we're actually able to quantify how many days of lost productivity we're losing. So as we continue to look at mitigating strategies and investments around testing, and we are in an antiviral testing protocol, that we're continuing to find that spot of how progressive we can be and how we can continue to see those offsets. And then, as Chuck was sharing too, that again, we're looking at it at a systems level. So to see where we see accelerating days. And so no different than how we would manage a short-term disability program in terms of looking for trends and looking for opportunities to reduce the exposure, continuing to do the same thing here. But again, just using our existing industrial hygiene practices. And so again, while we've obviously fine-tuned them to respond to COVID, it's just basically our underlying industrial hygiene protocols that we're using every day.
Great points. Well, Dr. Cherry, I'm going to circle back to you for the next one. Andrew's going to ask if requiring all personnel to enter the facility to wear a mask. Wanted to know, would that be a reasonable defense in preventing the spread of the virus?
So when I hear defense, I think of actually an attorney on this, but let me speak to this first. I think the medical perspectives of how do you protect the workforce as best as possible? I think what's absolutely key is really, again, that zero tolerance of illness in the workplace. And so some of the things that speak to that would be, one, having a policy that says that to your employees, and that there's a compliance tool to some matter, whether it's just signing the HR policy or if there's this kind of daily attestation. I think on site, what's a very effective tool is temperature screening that can be systematized, whether it's a thermal camera or people being screened with no-touch thermometers. I think that's very important. Also, just doing the symptoms check, which I think can be done as part of that earlier attestation. I think all that is really as proactive or as part of what we call primary prevention. So prevention before the cat gets out of the bag, so to speak. Wearing a mask, I would say, is also reasonable in the sense this would be for those that are asymptomatic but infected. And so when you wear a face covering, you're limiting that spread for that population. And so I do think it's an appropriate technique. It's actually specifically spoken to in the critical infrastructure return to work for those who are exposed to a COVID-19 confirmed case or presumed case. They could return to work without following that 14-day social isolation period. But I think those primary preventions that I spoke to earlier are really most powerful. I'll leave it to Chuck and to I'm under the gun here. Malcolm. Sorry about that. My mind was a little fatigued there.
No, in a couple of weeks, it's okay. Well, if Malcolm doesn't mind, I'll jump in real quickly. I mean, I think that when you talk about defense, right? So the other thing that kind of tickles my brain is, does that mean that that's all you have to do, right? And I think that the answer is no. I don't think that's all. I don't think you can just say everybody has to wear a mask and you're good. There's a couple of reasons for that. One of them is you got kind of that first question about, if you wear a mask too long and it's worn out and it's all waterlogged, do you create other risk through that approach, right? And so there's just questions that arise, right? So it's like, who's providing those masks? Are you asking people to bring their own before you let them in? And then the question becomes, what's the nature of the business, inside your four walls that you feel like this PPE is going to protect adequately the spread, right? If you're a grocery store where people are touching everything, I think it makes sense for everybody in the store that's coming in to wear a mask, right? But if you're kind of an office-based facility, again, part of the kind of identification of risk that you need to go through in terms of an internal infection control policy, part of what you should do is identify kind of high risk, medium risk, low risk based on their working environment. If you determine that, if you're a brick and mortar retail location, for example, I mean, it's reasonable to say in that case that folks are high risk. And so masks, I think, are reasonable in helping mitigate the risk created by that environment and those workers. But again, that needs to be in conjunction with industrial hygiene practices, disinfecting on regular bases, how often are you cleaning your bathrooms? How often are you cleaning countertops or coffee stations? Like, all these issues come into play. So I just want to be clear that what we're not saying is if you wear a mask, you're good, no big deal, right? That's not the case here. Wearing a mask in many circumstances, as we've heard and as we continue to hear, is useful for many different reasons, so long as you've got other protocols and processes designed to also mitigate risk of spread, right? You go to Disney World whenever they reopen, folks are going to be wearing masks. Disney's selling masks, right? They're available for pre-order, but that's not all that they're doing. It's not, and so Scott's laughing because he knows I'm a Disney freak. I think that it's there's more to this story here, and so what I don't want to do is give folks the impression that if everybody wears a mask are good, because that's not the end of the story here. Is it a good thing to consider? I think it is, but you got to think through who provides the mask. If you're asking people to bring their own, if it's your employees, how are you going to manage kind of that? You got to wash it X number of days. You got to have at least 4. You're switching them out. I don't know. I mean, you got to think through that from a policy perspective and process enforcement as well. And then the last thing I'm going to say, we talked about kind of this, the enforcement memo from OSHA saying COVID-19 is recordable. There is some relief for non-healthcare businesses. However, if there's objective evidence that it was transmitted at work, and if the employer, had reason to know or had reasonably had access to that evidence, it's not going to be, you're still going to get tagged for it. And so I don't feel like a mask by itself is going to be good for you in that circumstance, right? Because if folks are getting sick in a given kind of common work area, and you knew or should have known because they're all reporting into HR that they're not doing good, and they've got symptoms consistent, with COVID, or they're going through a daily health attestation, doesn't matter. There's still going to be circumstantial evidence that's going to be used against you, just from a kind of liability perspective.
Malcolm, did you have anything you wanted to add to that?
Yeah, I think just maybe a day in the life of it is we are reopening. We are requiring masks as part of our reopening as we phase back in. And I would just build on what we heard earlier, that it's just part of a layering on, running parallel protocols as part of a comprehensive system. So rather than just having a single thread, multiple layers of risk mitigation right there. And I do believe it's where we are on the spectrum right now. It very much makes people feel at ease. Interesting enough, there was an editorial, I forgot who sponsored it over the weekend, and compared wearing masks to trampoline injuries. So quick tangent real quick is they were just saying too that pads and nets, they've actually seen trampoline injuries go up because the perception is that you're safer if the trampoline has nets and pads on it, but actually in some cases too, it can drive the behavior a little bit. So there's a really big behavioral design piece there. So this is a broader piece around developing as a company these universal precautions around, how do we prevent a safe work, or not how do we create a safe workplace? How do we prevent these incidents from occurring? I mean, it's no different than every accident is preventable. And, really bringing in that headset, that mindset. And I think for us, while we mentioned on the spectrum, the masks are part of it today. It's always think about what's next. Where do we go? How do we continue to evolve this and think it from a risk mitigation standpoint? I mean, as a company, our particular company, we are looking at technology. And, we do have I mentioned earlier, our reference that we have an antiviral testing protocol that we have the majority and we'll have most of our organization under. So continuing to think about where do we go next, and how do we take the organization down on a journey? I mean, because it's not wear masks for 30 days and CREA goes away and we're done. It's really about how do we continue to advance this, and how do we continue to mitigate the risks that we're going to continue to find and identify in the workplace.
Okay. Well, we spoke last week a little bit about litigation, and so Chuck, you may want to chime in on this one. Josh is wanting to know about objective evidence. He says he's wanting to know what specific evidence would be required to defend claims.
So I just want to read this to make sure I understand it. Objective evidence to defend. Okay. So here's the perspective. So what the guidance says is that if there's objective evidence that someone caught the disease at work, right, and if the employer had reasonable access to that evidence, then the employer is going to be found at fault, right? So my perspective is the best way to defend against this kind of standard is by having a daily record of what folks are reporting, right? How are you feeling today? What's your temperature? What symptoms are you experiencing, if any? As you build that record over time, and if someone comes down kind of the line a month or two from now saying they caught it at work, you have the ability to go back and look at that individual's records to see kind of what they were reporting on a daily basis, firstly. And then secondly, what people that work within kind of a common area of that individual, what they were reporting. If you have a record of anybody through that process being taken out in isolation, testing positive, any of these other steps, right? And all of this being conducted under the kind of auspices of an infection control policy that's being administered effectively through process discipline and other processes that you have implemented. That kind of evidence infrastructure is going to be really tough for anybody to get around if you're doing it right. If you're ignoring it and you're not paying attention to the data that's coming in, you don't have a good partner that's giving you executive summaries, you don't have a good internal process to manage because HR is getting killed. You know, it's going to be tough to kind of use that to your advantage, so to speak. But really what we're talking about here anyway is keeping the workforce safe, right? Keeping kind of your team from not getting sick. And so it's for me, it's really easy to get aligned on this because I get two benefits, right? My HR hat, I'm making sure that my folks are taken care of. My legal hat, I'm making sure I'm insulating myself against liability because I've got a daily record that I'm kind of comparing against a given workforce. And if I see an outbreak or if I see some indications that there may be some disease spreading, I'm taking those folks out immediately, right? I'm taking steps. I'm not letting them through the door, right? If I get them tested, they're asymptomatic, I'm following protocol. So, you know, I feel like, you know, again, and this is true also for those states that are relaxing workers' compensation standards, right? It's a presumption it's caught at work for certain roles, but it's rebuttable, right? And again, how do you rebut the presumption? The objective evidence that you're gathering and this kind of trending record you're maintaining over time of the individuals and the team that individual works with, right? That is going to be much more powerful than you know, coming to the table saying, well, everybody wears masks, for example, and that's good enough, right? And not to mention the fact that the person that comes to you saying that they caught it while at work, they're going to be held accountable. Did you follow our policy? Did you follow our process? And if they didn't, that creates an interesting issue as far as defense. And it also creates kind of another angle for employers to utilize when you've got individuals that, you know, I mean, malingering is an issue in the workforce, and there's no exception here. We expect folks to maybe, you know, not be totally truthful. We'll see, you know, but that's the lawyer part of me talking about that. And I think you got to make sure you've got a process in place to hold them accountable. That's my thought.
Did anybody have anything they wanted to add to that? Malcolm, did you have anything in addition?
I think just to sum it up, I mean, I think when we think about kind of a guiding principle for us in this space is if our employees or any employees, if an employee doesn't feel safe, your business does not work. And I think for us, it's just bringing in that health and safety piece so that, you know, employees do feel they can trust the company, they can trust the company's doing the right thing, doing right by them, and doing it right by their family. And I think that's the insightful piece for us, is using that as a kind of a design and just an underlying first principle is that if our employees don't feel safe, our business doesn't work.
Great point. Well, the final question comes from Mike, and so he asks, can you not establish a policy that by coming to work, the employee is attesting to their good health, similar to by cashing this check, you agree that you're waiving liability? Chuck, do you want to take that one first?
Sure. Yeah, sure, you can do that. Is it going to work? I mean, I think that, you know, we've talked about kind of wearing masks as a defense, having a policy that says if you show up, you know, you're good. I don't think that's good enough. I think, you know, can you do it? Yes, you can do whatever you want in terms of a policy approach you want to take, as long as it's not violating law. But I think the question I would ask back to you is, let's say you establish this policy and you have an outbreak in one of your facilities. What evidence do you have to go back to suggest that, well, they said that by showing up, you know, they weren't sick. Well, maybe they're asymptomatic and they're carrying it. They don't know. They're not getting tested. Maybe testing capability is not where it needed to be yet. I think there are too many variables at play to suggest that just by kind of setting a standard that if you show up, that means that you're good to go, right? I think there's too much at play because you're allowing the individual to kind of make that call. And first of all, are they qualified to make that call without any other information being kind of obtained? Probably not. They may know that they've got rent due and they got to show up to work. Like there's too many external factors at play. I think that maybe some of the sick leave issues kind of mitigate some of that individual personality risk. But there's also folks that grew up kind of like the Gen Xers, you know, like myself. You kind of you just get up and go to work. I mean, that's just the way it is, whether you're sick or not. And I think that that's one of the dynamics that you need to kind of be able to manage through. And that's probably why, you know, an approach where you simply say by showing up and clocking in, you're good to go is not going to be successful, because that's not objective evidence, right? That's kind of a policy by itself. And a policy document by itself, it's better than nothing. But I really don't see how that's going to effectively, you know, shield you from other evidence of folks being asymptomatic carriers in a common area, and then all of a sudden you've got folks that catch it in a given work area, right? I think that's kind of the bigger risk at play here, just from a practical standpoint.
Okay. Dr. Cherry, you or Malcolm have anything you want to add to that?
Sure. You know, I think for me, the big issue is, especially for non-medical folks, non-medical employees, it does need to be a culture shift. I think that shifting from, you know, coming into work like Chuck says, just because I might have some mild symptoms, but you know, culturally, I've always come to work, so I don't call in sick. You know, we've heard of those people that never are sick or are very just dedicated to the job. I think by having policies and programs that help shift this culture from just coming in regardless of how you feel to a system or process that helps each person kind of do that safety check before they come into work and say, am I feverish? Do I have a cough? Do I have a sore throat? All the kind of classic sick symptoms. If we are, as business leaders, if we are passive in this, it will allow every employee to interpret that standard to their own. If the company issues them an app or some type of protocol that they take a minute out of their day before work to actually assess themselves, it will mean that it matters to the company, and so it should matter to the employee. When I was in the military, I helped manage what we call a personal reliability program, and so this is that on steroids. Like, you absolutely could not come to work unless if something changed in your medical status, you got a prescription, you took over-the-counter medication. If you had new symptoms, you would have to report to the clinic and be cleared. Obviously, that's very special and rare. I'm not saying that for that, but the culture there was very different. Everyone knew they had to come into the clinic when something changed in their medical status. And so this is similar to that, but more broadly offered, to where maybe it is just an app or some type of poster that is shown before you come into the actual work site. Do you have these symptoms? But really, you want to provide a cultural shift. I actually was asked one day, or someone was asking, what is culture? And it's really hard to define, but basically it's behaviors that people learn, maybe even subconsciously through their environment or through their social interactions, that becomes almost unconscious. And so right now there's a lot of variability in the culture of illness in the workplace, and now we're seeing kind of the ramifications of that. So that's been kind of my thought on this. How about you, Malcolm?
Thank you, Malcolm.
Yeah, Scott, I've just built off what you said too about culture. A lot of times too, everyone always thinks about organizational culture, but organizations are not what changes. It's the people that change. And I think what you just described there is the behavior changes that all of us have to find a way to drive our organization towards, to build those micro steps every day to change it. Our journey over the last 45 days as a management team and maintaining our operations, we've kind of approached it as kind of on these universal levels. And, level one was much like you said, just, much like the question teed up, if you're sick, stay at home. And we just really reemphasize that. And then, level two, we moved to the confirmation statement through the daily self-assessment, the attestation, so that we really are asking people to complete that checklist. This morning, we encourage for all of our folks coming to the office that are returning this week, that they are bringing that practice on. We track against that. We see how many self-assessments we have, and it's that daily mental list. And then that third level, again, first level is that universal, stay at home if you're sick. Number two is, the confirmation. And then level three is a medical confirmation. And it really fits in within our construct of a fit for duty. And while we often think about fit for duty in our line of business as part of maybe an annual hiring, or maybe an onboarding piece as pre-hires, a functional capacity, or an annual type of confirmation that they're eligible to do the job still, we're really bringing that into the workplace or into the daily practice now of a daily fit for duty, and really starting to think about ways that we integrate some different biometrics and then biomechanics into that assessment. So again, it's just allowing us to really accelerate this so that it does become part of the culture, but not just organizational culture, but that, those micro habits that happen out there with the employee every day, because that's really our best mitigation strategy, is changing it at that micro level is what will ultimately prevent it from coming into the workplace.
Great point. Well, I think that's going to do it for questions. I will ask the members of our panel, is there anything else that you would like to add? I'm sure you have any other updates that you'd like to provide.
I think I included a lot of my closing comments in that last answer, so I'll close it at. But thank you very much for your time today.
Great. All right, Chuck and Malcolm, anything else?
Nothing here.
Just one final comment, kind of off of what Malcolm said, and I couldn't agree more. I think that the impact that these things are going to have on your team members matters too. And there's other benefits that you may be able to gain here, right? It's not just about cost and problem, right? I think that anytime you engage in a process that's designed to engage your workforce and make sure they know they're taken care of, you get some benefits. I think if your organizations that track turnover, turnover costs money and resources. And so there's opportunities to improve metrics around turnover. If you track employer NPS scores, employee NPS numbers, if you start to trend those over time, you can start to see a difference in the way, your folks think about you as an employer. And I think all that matters here because, going back to kind of the first question, the potential legislation that may require employee input is going to be a lot easier for those organizations that are already engaging their team members now and making them feel like they're valuable. Right. So kind of a big takeaway there. And then the very last thing I want to say, I think I was a little flippant in my answer to that last question, right? Can you do it? Sure you can. Look, I think every single business out there has this thing called a risk tolerance. Okay. It's up to you to determine kind of what your risk tolerance is. And when I say you, I'm talking to the board of directors. Probably none of them are on this call right now. But the bottom line, kind of opportunity, kind of risk reward here is, as businesses think about their risk profile, there are levers you can pull, things you can do that change the cost today, to manage a risk. What has to be considered, however, is if you kind of pick a fast and loose option that potentially could give rise to higher than average liability, that's a risk that the business has to knowingly enter into before you say go, right? So everything that Scott and Malcolm and I are talking about, we have a very strong perspective on best practice because we feel like all of these kind of solutions holistically are the best things for the businesses that we manage or work with. So based on a defined risk tolerance support from the top down. So that's kind of my parting words here. Risk matters in this analysis. And so it's not just about, can I do A, B, C, D, and E? As I said, you probably can, but you have to appreciate and understand the consequences of those things that you want to do. And any action you are going to take has to be kind of bought off on at the top, right? Because anything you do today to support, and I know my ops guys are getting killed, guys and gals are getting killed, right? It's hard to run a business when everybody's sick or you're taking people out. I get it. But what happens if you rush people back in, and instead of getting to a place where folks are good and we feel really good about the safety of our workforce in a month, call it, instead we've got this vicious cycle of sickness that continues for the next 12 to 18 months until the vaccine's ready, you know? And that may be unavoidable, I don't know, but that's what you need to consider and think through, right? It's kind of this risk of multiple burdens of adopting a standard that's below kind of best practice. There's tons of operational issues, there's economic issues, and there's liability issues. You know, so engage with your teams, you know, talk about what makes the most sense for your business, you know, and then move, right? Because we can't afford not to.
Great. Well, Chuck, Dr. Cherry, and Malcolm, I appreciate you all joining us today. Just a few quick mentions. If you haven't already signed up, we do have another webinar that's going to be posting on Thursday at 1 o'clock p.m. Central with our president and CEO, Mark Robinson, which is Pandemic Perspective, the Pathway Forward. We also have an excellent white paper. In fact, it's our most popular download. It's the World After COVID-19 Infection Control and Return to Work Strategies. Actually, Chuck was the one that wrote this as well. You can download that for free from our website. Don't forget to send us your town hall questions to coronavirus@axiomllc.com. And finally, should you have any questions regarding the coronavirus rapid response program or the new check-in to work app, please be sure and reach out. So thank you again for joining, and we look forward to talking Thursday at the webinar. Stay safe.